Hi, everyone. I'm Colleen, and I'm back for another live stream brought to you by the awesome people over at Princess Dental Staffing. So happy to see everyone here on this Wednesday. So today's topic, we are talking about how to manage the most common issues dental assistants face. So it can be extremely rewarding being a dental assistant, helping your patients get healthy and really contributing to their overall health. But there are definitely some challenges involved, just like any other job. There are definitely some challenges involved and, things that make it just a little bit difficult. So today we are going to be talking about those challenges and what you can do to face them head on. But before we dive into that, just want to remind everyone that each week we are bringing you a new live stream talking about your career in the dental industry. If you don't want to miss out on future streams, be sure to like our page, subscribe to our channel. Got a question? Comment it below. Do you like the content that we're bringing you? Drop us a like. And if you want more information on the topics that we're bringing you, be sure to check out princessdentalstaffing.com. So Princess Dental Staffing is an online dental job board that has positions available for front office, dental hygienists, dentists, and yes, dental assistants as well, full-time, part-time, contract, permanent, and a lot of different areas, okay? So while you are on princessdentalstaffing.com and checking out their blog to take a look at all of the information, a lot of which we are talking about on these live streams as well, you can also start searching for jobs in your area, okay, that fit your needs for a position. You can also create a profile and get your information in front of hiring managers, okay? So be sure to check that out, okay? Alrighty, so let's dive into today's topic, managing the most common issues that dental assistants face. So let's talk about some of these issues and what you can do to tackle them. Firstly, communication between positions. This is probably the biggest and most common complaint among dental assistants. There just doesn't seem to be a lot of communication between positions. So, the workflows get a little bit wonky when you're not sure what stage the patient is in, what they need, and who needs to be there, right? So it can lead to a lot of misunderstandings and confusion and really just kind of mess up the workflow in the office. So how do we tackle that? Make sure that you know everybody's roles in the office and what those different roles are responsible for. You may discover some overlap. Okay, in which case, if there is some overlap, you can go ahead and address it and, just kind of, take care of who is going to handle what, okay, of those overlaps, okay? It also keeps open the lines of communication as well between you and your coworkers. So that line of communication is crucial in delivering the best patient care, right? Just making sure that everybody's open to communication and that you are transferring that information quickly and effectively, okay? Additionally, it's also really important to note that patients essentially go through kind of the same, essentially for the most part, the same routine every time they come in, right? They kind of interact with the same positions on a regular schedule, right? For an office hygienist, okay, and those sorts, that sort of order, right? So what's really important is discovering where you, the dental assistant, fit into that flow, right? You're the piece where your piece of the puzzle fits into everything, okay? So that you know where you're involved in the patient handoff and where you need to be before the patient and after the patient is handed off to you, okay? So, for example, when it comes to sterilizing equipment, do you sterilize the equipment before the patient comes in? 15 minutes before their appointment? Right as they come in, or right after the previous patient leaves, right? So where do you fall in? What makes most sense in terms of patient flow and patient visit, right? And how the workflow kind of all works together, what different positions are involved in the flow, and where and why and what they're doing and how, right? So it's really important to kind of get that big picture view of patient appointments in your head so that you know what to expect, okay? And you can kind of adjust accordingly, right? Okay, so that was number one. Number two, patient anxiety. And we've talked about this quite a bit in previous streams as well. It's not, it's common knowledge that, a large percentage of patients have some form of anxiety when they go to the dentist, even if it's just for cleaning. Okay, so they have some form of anxiety, and that can be attributed to a few different things. Going to a dentist office can be really overwhelming, right? There's lots of stimuli, drills going, cleaning in other rooms, people talking, equipment, all those sorts of things. And even if you have a dental office that caters a lot to children, you might even hear crying patients. It's a lot for someone to take in, especially if they're someone who works in a quiet office all day and they're just not kind of used to all of that stimuli, all of that noise, and all of these moving pieces, okay? Additionally, you add on top of that the fear of pain, right? The fear of the cleaning and potential pain, the fear of someone working in your mouth and you can't even see what they're doing. You can feel it, but you can't really see what they're doing, and they might be using all these loud instruments in your mouth. It can be quite overwhelming. So it's not a stretch to see why patients might have anxiety every time they go to the dentist, right? So you have these patients, they're full of anxiety, and as a dental assistant, you have to work with that. So what's the solution here? What do? Make sure that you present a calm and collected attitude, professional demeanor the entire time, okay? Your calm demeanor really helps patients get through that anxiety, okay? It's really, really crucial for patients. So make sure that you are, that you maintain that calm, collected behavior. Just have that confidence to know that you are the expert and you can keep in control of the situation, okay? Excuse me. Another thing that is very, very helpful in this situation is transparency. Let the patient know what you're going to do before you're going to do it. Okay, I'm going to numb this area right now. Okay, I have to give you a shot here. You may feel a little pinch. Check in with the patient. How are you feeling? Are you okay? And those sorts of things. Those things are really going to help quell the patient's anxiety, okay, and kind of reduce their stress levels being with the dentist. And really, and again, it helps build that trusting rapport between you and the patient as well, which is so important. Okay. Let's see. There's definitely a lot going on for sure. I can totally say how it may be overwhelming. Yeah, Drew, absolutely. Especially, like I said, especially if you come from like maybe a quieter office, or maybe if you work from home and you just don't have, a lot of those noises normally, it can be a bit overwhelming to kind of step into that environment. So, really important to be empathetic with the patient and understand why that they might be feeling anxious and why, right? Okay, so that was number two. Number three, patients not showing up, okay? So, typically most dental offices are set up so that when one patient finishes their appointment, then they schedule the next appointment about 6 or months in advance, right? So once the patient is done with their cleaning, they go up to the front desk. I know at my dentist office that we go up to the front desk and they just go ahead and schedule it 6 months in advance. That's really hard to remember. I always put it in my phone, so I always get a reminder, but not everyone does that. Some people kind of write it down, or they get the little card sometimes, or they lose it. Sometimes you just don't always remember you did 6 months ago. So it's really important. That's how you fix this situation. Oops, sorry. Oops, I think my internet for a second. Okay. Hopefully you guys can still hear me. Okay. So sorry. So the patient makes the appointment 6 months in advance, and sometimes they forget. And if they forget, and then there are no call, no show, and it can really mess up the flow of the office, right? It can really kind of disrupt, the day essentially, and all the things that need to get done during the day. So the way to combat that is, of course, and we've said this so many times in other streams, but it's really, really important to follow up with your patients and to remind them that they have an appointment coming up. So you might do that a few days before, or up to a week before go ahead and remind the patient. And there's software that helps with this. There's systems and software and applications that can help with this and do an automated reminder. But remind the patient that they have an appointment coming up. And if they can't make the appointment, go ahead and reschedule them as quickly as possible so that the appointment slot that they are vacating gets filled as quickly as possible. And that way you've got a full day. It doesn't disrupt your workflow as much. And of course it helps keep you in business, right? Patients bring in money, and which is really important for the business to continue. Okay. Alrighty. Okay. So number 4, patients that are patronizing for the title assistant. Okay. So this is kind of not as common, but it does happen. We've had definitely some dental assistants who have kind of reported this happening, where people hear the term assistant and they don't find a lot of value in that, right? That people hear assistant and they think maybe you're not as trained or you don't have as much knowledge as maybe you should to be answering some of these questions, which is completely not true. You may even get that from coworkers sometimes. Okay. So, and that can really kind of weigh on you a little bit, people kind of degrading, or looking down on, the work that you do, because the work that you do is really essential and really crucial. So what do? We maintain our levels of confidence. That's the solution to this. Know that you are the expert, know that you have had tons of training, and know that you are experienced enough and knowledgeable enough to convey this information to the patient and to coworkers as well. And speak up for yourself, respect your coworkers and your patients, but be able to speak up for yourself and say, hey, you know what, actually, I am a quintessential part of this office and I'm really important. And you can even talk a little bit about the education and training that you've received that's prepared you for the role that you're currently in. Okay. Alrighty. So number 5, stress of the job. Okay. So just like any job, you're going to have some level of stress, especially if it's a job where you have a lot of customer service, right? A lot of patient interaction. That can be very stressful, very overwhelming. Dental assistants, they work long hours. They're usually on their feet most, if not all of the day. They work with a lot of patients, and not every single one of those interactions is going to be positive and happy. Okay. It's not always going to be fun, but and not only that, but if you're not taking care of yourself and you're not managing your stress levels, making sure that you are setting yourself up for success, right? We don't always get our 7 to 9 hours of sleep. We don't always eat well and regularly. We don't always hit the gym or get that exercise in the way that we know that we should, drinking our water, all those sorts of things. Sometimes life happens and we're just not setting ourselves up for success. When we miss those sorts of things, which can make stress even more unable to be managed well. Okay. So sometimes it just happens. Sometimes you just get a little bit overwhelmed. Okay. It's going to get stressful. So how do we deal with that? Okay. First of all, ask for help. And, I'm going to be honest with all of you. I feel like such a hypocrite having to say that, because I'm definitely the person. I have the hardest time asking for help. I don't know about all of you, but I definitely get those thoughts, I've done this a million times. I should be able to take care of it now. This is my job, so I should be able to handle it just fine. I don't want to be a burden to other people by asking them to take time out of their busy schedules to help me, right? And what's important to remember is that everyone needs help sometimes, right? We can't be superheroes and do everything perfectly every single day. At some point in your life, you're going to need to ask for help, and it's an okay thing to do. It's not a reflection on your work ethic or your capabilities. Sometimes you just need a little extra hand. So it's really important to to let your supervision know that you're feeling a little bit overwhelmed, that you're feeling a little stressed out, and you could use a little extra help. And at the end of the day, you and all of your coworkers are there for the patient. So it's not burdensome to them to ask for help, okay? Because again, they're there for the patient. They're there to help out the patient, okay? And if you can't provide 100% that day for whatever reason, then it's not burdensome to ask for help because it's for the patient. Okay, so that's just something to remember. And that's something I have to repeat to myself all the time. Trust me, I know the struggle, but it's really important to ask for help because at the end of the day, it's about the patient and you want to make sure that the patient has the best care available because that's who you're there for. Additionally, make sure that you respect your own time and that you set those boundaries, okay? If you're asked to stay late and you just can't work late for whatever reason, you have another appointment or you're just stressed or overwhelmed, make sure that you set those boundaries, say, I'm sorry, I can't stay late today. Now, it's always great if you can stay late, if you have the emotional and mental bandwidth and physical bandwidth to do so, and you don't have another appointment that you have to get to. It's always appreciated and always shows great teamwork to be able to stay late and to help out where you can. But at the same time, know your limitations. And if you're just not going to be 100%, know that, go ahead and express that and just say, I'm sorry, I can't today, okay? Another thing you can do is make sure you're taking short little breaks between patients, okay? 30 seconds, a minute, 2 minutes, 5 minutes. Make sure you're taking, if you're feeling stressed and overwhelmed, make sure you're taking little mini breaks between patients to kind of collect and recharge for a second and do what you have to do. Maybe it's breathing exercises, maybe it's meditation, maybe you just need to fix yourself a nice steaming hot cup of tea or coffee. I like both. So, or maybe you're just a little hungry, you just need a quick snack. Okay. So, whatever it is that you need to do in order to recharge, make sure that you're taking those little breaks between patients. They add up during the day and they can really help fuel you to continue and to finish out your shift. Okay. So make sure you're taking that time for yourself and remember, investing in yourself means also investing in the patient. When you're at 100%, you're able to give 100%. If you're not at 100%, you're not able to give 100%. Okay? Always important to remember. I agree. Sometimes it's tricky to balance the right times to ask for that help as well. Yeah, Drew, absolutely. I mean, everyone is busy, but you have to trust in these other professionals that if they are busy and they just can't help you, that they can express that and say so. Okay? A request for help, of course, is not that they just have to drop everything and help you. Sometimes people are going to be busy as well. And from there, you're just going to have to work from there. But it's always okay to ask for the help. Okay. Worst case scenario, they say no, and you're just going to have to work through it as best as you can. Okay. But always a good thing to ask because a lot of the times people will help where they can. Okay. Alrighty. So let's recap. Okay. So firstly, communication between positions. Communication starts with the individual. So make sure that you are keeping the lines of communication open, and that's going to increase communication between positions. Make sure you understand patient flow and everyone's position and how they all fit together and where you fit as the puzzle piece in this puzzle that is the patient appointment. Okay. 2, patient anxiety. We all know patients have anxiety when they go to the dental office. I know that I do. Okay. So it's really important to understand why, to be able to empathize with that patient and to be able to help ease that anxiety where you can, through transparency, building rapport, and just explaining, what's happening and when. Number 3, patients not showing up, follow up, okay? Because, patients not showing up, of course, can really throw off the balance of the day. It can hurt the profit bottom lines. So make sure that you're following up with your patients up to a week in advance, and that way you have a better chance of filling vacant slots quicker, okay? Number 4, patrons that are patronizing from the term assistant, okay? Just because you're an assistant doesn't mean that you are not knowledgeable, that you are not a professional, and that you can't help the patient. Of course you can. Of course you're knowledgeable. So that's where that confidence really comes in, and make sure that that you're able to explain that actually I've had training and I've had experience and I've done all these things, and yes, absolutely, I can help you. Okay. And lastly, this number 5, the stress of the job. Make sure you're taking care of you. Okay. Make sure you're you're setting yourself up for success with, all of the elements that we all know, right? Sleep, healthy eating, exercise, water, all those sorts of things. But if you find yourself being stressed and overwhelmed, ask for help. Make sure that you set those boundaries and make sure that you do what you need to in order to get to 100%. And that way you can give 100% to your patients. Okay. Alrighty, so I'm so glad everyone could join me on this Wednesday. Thanks for tuning in and thanks for all the great comments. I'm sorry, I think I had a notification earlier that I had a little bit of internet. I had an interruption in my internet, so hopefully all of this came through just fine and you were able to hear me. If you have any questions, thoughts, insights, or what have you, go ahead and comment them below. If we couldn't get to them when this stream is live, we will definitely get to them as soon as possible at a later time, okay? But thanks for tuning in, everyone. We will be back next week with a new topic. So thanks for being here. Have a great week. Have a great weekend. Continue to stay safe, and I will see you soon. Thanks, everyone. Have a great